Ready? Welcome everyone to another wonderful episode here at Doctors of Podiatry. We had this young patient who came in to see us yesterday. The patient is a semi-pro dancer, and she sustained a really traumatic injury to the left fifth toe. We weren't able to record the toe was actually, the fracture was actually, displaced. And we were able to bring the toe back, the fracture back to its normal anatomical position. I offered the patient, in a lot of these injuries, I like to use platelet-rich plasma as a regenerative option to maximize improvement and minimize any long or short-term complications such as, we'll say, post-traumatic arthritis. Again, yesterday we reduced the toe, brought it back to its normal position, and I will show you guys now when we start the procedure. The toe was sort of looking this way, and now it's in the normal spot. The patient had a change of heart, I guess, in between, we'll say, yesterday and today. And the patient decided to come back to have, a little bit of PRP. Get another glove, please. To get another, not only PRP for the fracture, but the patient, many moons ago had an entire reconstruction of the foot and the ankle for a flat foot deformity. And she has been apparently also suffering from, since then, she's been able to just live with the pain. So, it was a very robust surgery. A lot of, fusion here, fusion there, transfer, of the tendons. It's a lot of work. So what we're going to do today is we're going to go ahead and, using our fluoroscopic, our fluoroscopy machine, under fluoroscopic guidance, we're going to deliver a little bit of PRP into the fracture site, which is what I recommended yesterday. That's why she came back. And also the patient requested that we also, deliver a little bit of PRP into the areas which she has been battling some discomfort for the last couple of years, to see if we can, improve that level of discomfort. So without further ado, let's proceed. So Patty, why don't you come behind me, and then right there, okay? So let's go ahead. So not just nice and straight, just like that, okay? So this is a fluoroscopy, a mini C-arm. It's an orthoscan mini C-arm. We're able to go live, okay? So everyone look up here, right? So if you guys can see there, the fracture's right there, right there, and I was able to bring it back to its normal, and everyone can see it there better. You see there's the little fracture, and we were able to bring it back, right, to its normal anatomical position. And again, just so everyone understands, this is the magic behind this machine is that we can actually, you see, everything is live. Okay, so without further ado, I'm gonna go ahead and get the PRP right here. We're only gonna deliver very little, okay? Before we do anything, we'll just kind of go like this, and I'm right on the spot. I haven't, everyone's looking, are we looking up there? So there's the needle, okay? If you feel any discomfort, just please let us know. Okay, so I'm right there, okay? So now what I'm going to do is I'm going to infiltrate a little bit. The patient may feel a little bit of discomfort. So I'm moving the needle back, as everyone can see. Now I'm going to redirect. Okay, redirect. Right there.
Is the bone in the right position?
It is. Yep. I'm going to come from the top a little bit here. And that's it. Okay. The reason why we don't put more PRP is because there's no space, and we see a little bit of a little bit of blanching there. So there is that level of what we call volume expansion. But you okay?
Mm-hmm.
Okay, good.
I'm worried that the toe is moved.
No.
No?
No.
It's in the perfect position.
Perfect.
Okay. Great, thank you.
You're very welcome. Okay. So now what we're going to go ahead and do is the patient, when they did this many moons ago, they placed a graft on this side, and you guys can see this doesn't look normal. You see how there's like a huge dimple here. Look at this crease here. There's a lot of derangement of the entire hind foot, and they fused here. They just did the whole enchilada. Let's bring the foot a little bit forward now. Okay. So a little bit more. There we go. There you go. So let's look at the monitor here. So this is actually graft right here. This is the calcaneocuboid joint, and they did a procedure here. It's all, you guys can't really tell that there's a graft there because it's already incorporated, but we're going to marinate this entire area, starting even from here. I'll probably start from the top, kind of like this. Okay, and here we go. You okay? Mm-hmm. Super. So now I'm marinating all of this area here. So let's keep on looking up there. And also part of the problem is that there's two very important tendons here, and I suspect that, let me have the other one, please. I suspect that those tendons have suffered quite a bit.
Yeah, in that spot that you pushed that really hurt,
okay.
It's funny, I'm feeling it right now, which is weird. Yeah, like that is a painful spot.
Is it this right now?
I feel something there.
You feel a little something?
Yeah.
Okay. That's normal, by the way.
Yeah, okay.
Totally.
But that's a very painful spot for me.
So what we're going to go ahead and do is we're going to come in here and go into the area where there was right there. And I'm actually moving the needle back. All of this area. We're marinating it with PRP. Thank you.
I feel it.
you should feel pressure.
Pressure, yeah.
Yeah.
Pressure, I feel.
And then what I like to do is I like to get into that joint.
You're gonna go inside the joint? Oh no. Not too inside. Please don't go too inside. I'm scared. Ow, 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 ow. Please stop.
Okay. So there are certain areas where if it's too deep, the anesthesia won't really work as good as it, yep. It'll throb for a couple of minutes like before, but
It's hurting like my whole foot.
you know, I've always said it in the past, PRP, there's one little spot that I really want to get here.
Yeah, in the front.
Yeah.
Yeah, like all the way up there. Yeah.
Okay, so we'll go ahead, and not only that, I feel a lot of scar tissue.
Yeah,
A
because the
lot.
needle can't even get in.
Do you feel that
Yeah.
as well? Any pain now?
No, that area is fine.
No, that area's fine. Okay, good. You felt that celery-like sensation? Well done.
I just want to point, so. Like, oh my god.
No, no, it's okay.
Like right here. Do you think it's going to get into here?
Yeah.
That area. You push it there.
We're gonna, yeah, everything's just gonna move, definitely move around.
Yeah, because it's that point, like right here that hurts. Like here also hurts.
Okay. So we're all done. Fluoroscopic-Guided PRP injections maximize improvement of the recent fracture, the recent digital fracture, as well as, you know, trying to maximize some chronic discomfort that the patient has been battling for many, many years.
So chronic pain.
Chronic pain.
I still feel that when you went in the CC joint, I still feel like the pressure, it's right here.
It takes about 5 to 7 minutes for that discomfort to go away.
Okay.
And you'll definitely, in a couple minutes, you'll tell me, oh, it went away.
Did we go actually inside the
No.
joint? No, just around?
Just around. It's just the problem is that this is when you use the C-arm, you're not looking at the different angles, right?
Yeah. So it looks like you're going actually in the joint.
We're not.
We're not, okay.
No. We're actually on top.
Oh, he's on top. It was so like it's right here. Okay. Okay.
For the entire world, how was the procedure?
Oh, it was really good. It was great. I
Okay.
mean, yeah, it was.
Is it what you expected?
Yeah, no better. I mean, it was fine. It wasn't so bad at all.
Okay, great. As always, you know, we continue to use PRP, Regen Medicine, for different clinical presentations. The sky's the limit, whether it's a fracture, injury, acute injury, chronic injury, we use it for pretty much everything, including all of our minimally invasive foot and ankle surgeries. Maximize improvement, minimize long-term, complications. That's our goal. Platelet-rich plasma. We drew her blood, we spun the blood. We drew her blood, spun the blood, and we isolated the PRP, the platelet-rich plasma. The platelets contain all the growth factors and important cells that aid in the regeneration of damaged tissue. And that's exactly what we infiltrated here today. So we're going to definitely immobilize the area with a Gucci boot or Prada, I don't know. I would definitely keep everyone afloat on this patient's progress. As always, www.josspodiatry.com, Instagram, Dr. Tojam, Joss Podiatry, Facebook, and last but not least, our YouTube channel, Joss Healthcare. Like always, thank you for watching.